One of the skills you may be asked to perform when you take your state exam is to provide foot care to a client who is sitting in a chair. Soap and water is used and foot care is provided to only one foot. The client is sitting in a chair. The client's sock and shoe are replaced at the end of the skill. The role of the resident client is played by a person. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Put on clean gloves before washing foot. Before washing, check water temperature for safety and comfort and ask client to verify comfort of water. Provide support to lower extremity throughout procedure as needed to avoid strain. Place water-filled basin on protective barrier on floor to avoid resident clients barefoot directly contacting floor before, during, or after foot care. Soak resident client's foot in basin of water. Apply soap to a wet washcloth. Lift foot from water and wash top and bottom of foot and between toes without adding soap directly to basin of water. Rinse top and bottom of foot and between toes. Dry entire top and bottom of foot, including between toes. Dispose of used linen into soiled linen container. Warm lotion in hands or by placing lotion bottle in warm water before applying to foot. Apply lotion to top and bottom of foot. Do not apply lotion between toes. Remove visible excess lotion from foot if present after applying. Apply sock to foot, leaving sock smooth. Empty, rinse, and dry basin and place basin in designated dirty supply area. Replace shoe, leaving any fasteners such as ties secured. Make sure the signaling device is within reach. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate greet resident, address by name, and introduce self? Provide explanations to resident about care before beginning and during care. Place water-filled basin on protective barrier on floor to prepare for foot care. Use water of safe temperature for soaking foot. Soak resident's foot in basin of water. Use soapy washcloth to wash foot without adding soap directly to basin of water. Wash top and bottom of foot and between toes. Remove soap from foot, including between toes. Dry entire top and bottom of foot, including between toes. Warm lotion before applying to foot. Example, warming in hands, placing bottle in warm water. Apply lotion to top and bottom of foot, excluding between toes. Remove visible excess lotion from foot if present after applying. Apply sock to foot, leaving sock smooth, and replace shoe, leaving any fasteners such as ties secured. Provide support to lower extremity throughout procedure as needed to avoid strain. Avoid placing residents barefoot directly on floor before, during, or after foot care. Complete skill having rinsed, dried, and stored basin, placing soiled linens in hamper, and disposing of trash. Ask resident about preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before care completed. Promote residents' rights during care. Promote resident safety during care.